Welcome to Get Connected with Nina Del Rio, a weekly conversation about fitness, health, and happenings in our community on 106.7 Light FM.
Good morning, and thanks for joining us on Get Connected. Whether through age or injury, we all know knee problems are very common. In fact, there are over 600,000 knee replacements performed each year in the U.S., nearly twice as many as hip replacements. How do we prevent the most common issues? And when we're in need of knee surgery or replacement, what are our options? We'll find out more today with orthopedic surgeon Dr. Donald Polakoff, based in Monroe, New Jersey. His website is drpolakoff.com. Thanks so much for joining us today.
Thank you so much for having me.
So knee problems, we know they can have a tremendous impact on someone's life. Getting up from a chair, just walking, they can be painful and difficult. By the time you see a patient as an orthopedic surgeon, what is the condition of their knees and how is their mobility?
Well, frequently I'll see patients that are referred that have already had a reasonable course of conservative management. So I will often see people who have tried physical therapy, rest, medication, injections, and typically by the time we see them, their mobility is fairly impaired, and certainly activities, including recreational athletics, and even some day-to-day living issues is fairly impaired and painful.
Can you talk about some of the predictors that might even lead to knee surgery before they get to you, some that are controllable and non-controllable?
Sure. Unfortunately, the biggest factor for getting osteoarthritis of the knee is probably a family tendency. And I'm sure at some point in the future, medicine will work out which exact gene or enzyme defect or biologic issue. But with that being unknown, I would say right now that there's a significant family history which is not controllable. Some things are controllable. Certainly obesity, which is a major problem in the United States today, plays a role in many health factors, but arthritic joints and especially arthritic knees is highly correlated with being overweight. Also, repetitive, high-impact sports, overuse type of injuries can be associated with it.
You talked about osteoarthritis. Can you sort of define that and talk about some of the common ailments you see in addition to that?
Sure. Well, osteoarthritis is the leading cause of arthritic joint pain, especially knee pain. And it's what people refer to as a wear and tear type of thing because it's not a systemic illness. There's more associated with mechanical sort of problem and just general wear and tear. Other kinds of arthritis are rheumatoid arthritis, which is an inflammatory arthritis that may affect multiple joints, other organs. People will see people that have other entities, including things like gout, and that sort of inflammatory arthritis. And then there are different post-traumatic arthritic disorders as well.
Regarding injury now, when we often hear, I guess the number one thing people hear about is someone injuring their ACL, for instance, which is damage to one of the ligaments in the middle of the knees that connects the tibia and the femur, as I understand it. When you have an injury of something like that, how do you determine when someone needs surgery, and how does someone's level of activity affect the outcome?
Well, in reference to a torn ACL or other torn ligament problem, as a joint arthroplasty, as a joint replacement specialist, that's typically not what I would see. That would go to more of a sports medicine orthopedist. But whether or not to reconstruct those injuries frequently depends on a patient's age and activity level and demand level. In most younger and middle-aged active people, an ACL will be reconstructed. Somebody that's older or inactive, it may not pay to do that. Before reconstruction of certain ligament structures became successful, those knees had a very high rate of becoming arthritic, and we would see more of those people needing knee replacement. I think with the successful ligament reconstruction, some of those cases may be spared from going on to something worse.
So who makes a good candidate for arthroplasty? This is knee replacement surgery.
So the ideal candidate is someone who is old enough that a joint implant, a joint replacement, has a good chance of lasting their whole life. It's joint replacement is very rarely done in younger patients, but not so old that they would have high medical risks and not be able to get great use out of it. Frequently, it's people that are in low-impact sports, recreational sports, weekend athletes, people that want to just exercise at the gym, bike, swim, bowl, golf, dance, sort of doubles tennis, any sort of of the not high impact activities. The vast majority of patients are in their 60s and 70s, but the range will typically go from about 50 to late 80s.
So how long does the replacement last then? If you say you're over 60 or late 50s, it lasts 30 years, you're expecting?
Well, it's a difficult question because the longevity of an implant, the current studies, when they say, the X implant will last 20 years, that's based on an implant that was put in 20 years ago, and hopefully the technology of the implant design and the technique the surgeons are using will allow that to last longer in the future. So I've got plenty of implants that I'm now seeing at their 20 and 25-year follow-up in certain patients that are doing well 20 and 25 years out, and that's fairly old technology that's lasting that long. So the hope is that a current knee design with high technology implants and in a well-done surgical procedure can last 30 years or more.
So would that mean in the long term they'd be done at a younger age, perhaps?
Well, I think that's already starting to happen. I think due to the age, due to the activity level of a large segment of the population, and unfortunately due to some of the weight issues, we are seeing people at a younger age. There used to be more of a rule of thumb that you could not get your joint replaced until you were 60 or older, but that old saying has kind of gone by the wayside, and it's very common to see people in their 50s, sometime in their 40s, if it's depending on the situation, how bad the arthritis is.
We're speaking with orthopedic surgeon Dr. Donald Polakoff, based in Monroe, New Jersey. His website is drpolakoff.com. We're going to get into some specifics about knee surgery today on Get Connected, 106.7 Light FM. I'm Nina Del Rio. And as we talk about implants, are they custom made? Are they made to fit each patient? The existing ones, let's say.
Well, it's interesting. When I first started doing knee replacements, the sizes might have been small, medium, large, and that inventory has expanded so that most of the major implant companies, the typical implant will have about 10 to 12 sizes. So the sizes are really pretty close. They're pretty accurate. And the vast, vast majority of people who have a knee replaced get rid of virtually all their pain. To some degree, the issues are that the knee does not feel completely natural, completely like their own, and there are issues with ligament balance and precise sizing. So there's been more of a tendency to work towards what's been called patient-specific implants. There are really two variations on this, and therefore sometimes a misnomer. The most common thing when you hear about patient-specific is that there are several companies where the cutting guides, the instruments that you use to shape and size the knee, those have been made patient-specifically, individually based on MRIs or CT scans. But the newer, exciting technology is where the implant is actually patient-specific, and that is based on a three-dimensional CT scan and then uploads into a computer design program so that the implant is patient-specific down to the millimeter, but not just one dimension that's changing. The whole ratio can change. The whole coverage of the bone can change. And so there's really an infinite number of sizes, and I think that's potentially the exciting thing, to get a knee that feels more like your own.
And this is the conformist surgery, I believe, correct?
Correct. So there's a company, Conformis, and their implant, which is called the iTotal, is the first FDA-approved patient-specific implant. So it's the only one with an implant, not the cutting instruments, are patient-specific.
And you've been performing this since June, I believe, at St. Peter's University Hospital in New Brunswick, which hasn't been that long. Have you been able to see how recovery time has taken and that sort of thing?
Well, the early groups of patients have been doing very nicely. The patients have been enthusiastic. I've been enthusiastic. The X-rays look just great because you preserve the posterior cruciate ligament, because the sizing's so precise, because the bone cuts are really so minimal and so much tissue is preserved. I think they get up and going pretty quickly and feel very good. I could think back to a woman in her early 80s that had both knees replaced simultaneously the same day, and her goal is to get back to a minimum of golf and hopefully doubles tennis as well. And this is a woman in her 80s, and she's coming along very nicely.
So that's a lot of mobility, that's a lot of strength, everything pretty quickly.
Yes, yes.
So will this procedure be widely available soon? I know it's just kind of starting in places.
Right. So the FDA approval was just about a year ago, and originally it was the core group of designing surgeons. Since then, about 50 to 100 other orthopedic surgeons have been trained nationwide, and it's been people who have some expertise in knee replacement, and in addition have been invited and have shown the interest in going to additional laboratory and didactic kind of teaching on it.
So we'll just have a couple more minutes, and I want to get to sort of preventing all this in the first place before we jump off. To avoid issues in the first place, let's talk about someone with, say, arthritis, even as a young age. How do you manage that disease with regards to your knees?
Well, if you have arthritic symptoms at a young age, the ideal thing is non-impact sports. So if somebody's a jogger, hopefully they like swimming or an elliptical trainer or biking or something non-impact. The other thing, probably the biggest thing that people in the United States can do is to try to keep their weight closer to ideal. I mean, that's been a major health problem in multiple areas, and if you had to do something else, I would say it's really the weight issue. Another factor that often will lead to joint replacement at a later age is people that have torn meniscus, torn cartilage, and once that cushion has to come out arthroscopically, there's a little bit higher chance of that joint becoming arthritic in the future. So unfortunately, certain activities are at risk for tearing your meniscus also then make you increased risk for arthritic changes at a point down the road.
For everyone in general, let's say our weight is in good shape and we're participating in sports regularly or regularly enough. Are there knee strengthening exercises that you recommend or that we should avoid in combination with everything else we're doing?
Well, I think the important thing is to everything in moderation and to stay well balanced. I mean, strengthening will obviously protect the joint. Exercises for flexibility and stretching are very important. But even the most highly conditioned athletes in the world get injuries because unfortunately there's no level of prevention that's going to stop it all the time. But I think in general, just strengthening, good conditioning, flexibility is very important, and stretching would be helpful.
Dr. Polakoff's website is drpolakoff, drpolakoff.com. He's an orthopedic surgeon based in Monroe, New Jersey. Thanks so much for joining us today on Get Connected.
Thank you for having me. It's been a pleasure.
This has been Get Connected with Nina Del Rio on 106.7 Light FM. The views and opinions of our guests do not necessarily reflect the views of the station. If you missed any part of our show or want to share it, visit our website for downloads and podcasts at 1067lightfm.com. Thanks for listening.